Listen up. On October 19th, at Case Western Reserve University in Cleveland, Ohio, we're going to get together. My name is Bruce Savolio, and I'm from the University of Washington's Center for Leadership and Strategic Thinking. Actually, that's on a t-shirt. And what we're going to be talking about there is things that are in the box about healthcare, the things that are going well and the things that are working, but we're also going to get into something I call the disruption game. Now in that game, which puts us outside that box, we're going to talk about the things that need to be disrupted in terms of how we're going to change our healthcare delivery system in a way that transforms it into one that we all feel optimizes the kind of care we're giving. And one of the elements of that is that L on my t-shirt here, which I've been spending 30 years looking at in organizations around the world, many of which in healthcare. And what that L stands for is, of course, leadership. And we're going to look at leadership perhaps in a different way, and we're going to look at organizational transformation, I think, in a different way. And let me tell you how, as part of this disruption game we will introduce. The way we're going to look at it is not as changing an organization, but change in each individual. It's my belief, and the research that we've done over the years, is that you change an organization one self-concept at a time. You can't change an organization. You have to change each individual's self-concept of what they construe is that organization. More importantly, in terms of our discussion in Cleveland, is that we have to focus on the change in the self-concept of what it means to be a physician, a healthcare provider, a nurse, a technician, a volunteer, and perhaps most importantly, a patient coming to the healthcare system. So we're going to play this game looking at how do we change the way people think about their self-concept, which drives the way they identify with what they do every day and how they show up. That is the gist of what I want to talk to you about and what we're going to interact around and what you're going to hopefully ask questions with respect to what does this mean? What does it mean for me? So in a sense, even though this is a conference on interprofessional care, my focus is going to be on intra-professional care. That is you and me and how we're going to conceive of the way we go about delivering the best possible health care to the people that we work with. So we have to think about disrupting our education. We have to think about disrupting our residencies, our on-the-job training, our roundings. In fact, we have to look at it all and say, what do we need to disrupt in order to make a repeatable, reliable practice that produces the best, very best healthcare? I want you to do one thing, because I know you're going to come. It's 10:19, Cleveland, Ohio, Case Western Reserve. One thing I want you to do. I want you to come onto campus, and I want you to walk by a building which represents visually disruption. It's a building that was designed by an architect, global famous architect by the name of Frank Gehry. Now the thing about that building is it represents a wonderful piece of architecture, but what it does represent to the artist and the architect in that order, which is the way he would describe himself, is that it is a disruptive form of architecture that represents art to him and to everyone that walks by it. It's inspiring, and we want our conference to produce that sort of inspiration that you might take from walking by that building. So I want to see you on October 19th in Cleveland, Ohio. I really look forward to it, and get there soon. We got to get to work.